So we're really delighted that we've just recently reached a milestone of having 10,000 registered service users using our patient-held record. And what we know is that over 50% of those registered users are accessing the PHR at least once a month. So we know that it's delivering real benefits for our service users in terms of them accessing their records and seeing the data that's held about them. We now want to look at the functionality for those service users. One of the key things that we're keen to use it for is around improving our ability to measure outcomes and improvements for our service users. So we'll be looking at it to deliver some of our key surveys and questionnaires, such as Dialogue Plus and Care Plans. And hopefully that will enable us to really deliver scalable benefits and really access our whole local population.
We started with our children and young people, very co-produced. So we have a children youth board, and that youth board allows us to take development of PKB and what we want to do to them to make sure that the direction we're taking is driven by their need, not our wants. We've then opened that up to adults, so all service users in our organisation can access their appointments and their demographics. In children and young people, they can also access their documents, their care plans, their safety plans. And we've got really exciting things coming up for adults as well, where we've got libraries of resources coming for eating disorders. We've got outcome measures being developed with our psychology teams. And we are dedicated to making sure that care plans and safety plans are accessible to all service users, either in a digital format through our portal or through a paper version if that's their requirement. So when I think of our service users in mental health, sadly, so often they come with multiple comorbidities. Mental health is never just mental health. There are always challenges with your physical health, and you'll be receiving cares in multiple providers. The importance of that information being joined up allows you to see a holistic view of a patient, but also for the patient and service user to see a holistic view of themselves, to be able to understand the care that they're being received and coordinate it. It's really difficult when you're struggling with a serious mental illness or your mental health is poor. When you've got lots of different things coming in from lots of different places, it can feel overwhelming. It can be difficult to understand, and having that all in one place that allows you to share it with your nearest and dearest or the person that you trust to help you coordinate that, to understand it, so that you can go to your appointments and you're not left feeling overwhelmed and struggling, is incredibly important. It's also important to make sure that as an organisation, we're finding ways to share information across boundaries. That integration piece is incredibly difficult, and I don't think any of us have cracked it yet. But putting the patient at the centre of that is only going to make it easier and mean that we can improve things for the future.
We had a fairly low number of patients registered in our CAMS service originally. That's due to the nature of patients and the fact that we need to have larger clinical engagement with those patients. They're really engaged for looking at PKB. However, when we implemented with adults, we saw a huge spike in registrations, going from 200 up to the thousands really quickly within the first month. We could look at and analyse the data behind the scenes within PKB and understand who our users are, who are the age ranges of those. And it really helps us to then target areas to look at our clinical transformation, what sort of teams we would like to start introducing more functionality within PKB. It's been a fantastic experience. Within the team here, within North London Foundation Trust, and the PKB team have worked really well and really closely together. We implemented it again in 6 weeks, so therefore we had to work really closely together, and we received fantastic support from PKB to allow us to do that. They really assisted in all of the technical implementation behind the scenes that perhaps people don't really see. It was really, really helpful.
I think our vision is about moving into that preventative space. It is about making sure that every person under our care has the ability to access the information that they need at the right time and share it with the people that they need to share it with, be that a family member, another clinician in an emergency situation. It is about service users then taking that information and feeling that they're empowered to make decisions, to make changes if they need to, and remembering that the data doesn't sit with us. It's not our information, it is their information, and we should be sharing that and working collaboratively together to make better decisions to improve their care and their outcomes.